Hello, this is Dr. Do again. This video is still about alphabetic list of problems on letter O. I start with ocular diseases, and last time, a previous video, I in general talk about the emergency situation, emergency conditions associated with any kind of ocular diseases, and also mentioned about the eyelid problems, the sty or cleansing or the blepharitis. Today I'm going to talk about the other layer next to the eyelid. It's conjunctiva. Conjunctiva is the structure is a transparent layer cover the surface of the eyes, the white part, and also on top, also on inner lid of the eyes, upper and the lower. So what are the common diseases, common conditions with this conjunctivitis? I probably think about either infection, conjunctivitis, or some, since the membrane is very thin and there's some blood vessels, could have some bleeding, conjunctival hemorrhage, or the allergies. I think that's the on top of the injury, of course, trauma. But if it is trauma, usually it's not just conjunctiva. So that's then. I'm just going to talk about the infections, conjunctivitis, and allergy, and also sometimes the hemorrhage. In general, the conjunctival disease is, if for healthy people, usually it's self-limited or easy to manage. However, for those if it's not managed in time fashion or associated with the systemic diseases, then the infection will spread from the conjunctiva to the deeper tissue. Then that's probably sometimes could be serious. So and also there's another category of this conjunctiva probably is abnormal growth. It's called tertium, which this tissue proliferated. Fan-shaped growth, and sometimes it can cover to the center of the cornea. So this is the in general the different kind of conjunctival disease. So usually, let me talk about the emergency situation. I think it's if it doesn't have to be the conjunctivitis. So probably some other infections, crusting, cannot open your eyes, and the discharge is yellow greenish, not instead of white or transparent. So if that's the case, then you probably need to see your physician as soon as possible. But maybe just the conjunctivitis, or like I said, if not treated immediately, could spread deeper. So then that's I can think of the emergency situation associated with this conjunctivitis. So usually the conjunctivitis is viral infection is the common cause, the pink eyes, easily spread, and also for that management really self-limited, supportive care, isolate very well, do not share the towel or anything with others because it's easy to spread. And on top of that, sometimes this pink eyes can, if not managed well, like I said, or if there's a systemic diseases, it can become bacterial conjunctivitis. That's the case, has to really managed by your physician, either any kind of your eye doctors or other physicians, or emergency. Like I said, if you cannot open your eyes because of the crusting discharge of yellowish, so that means conjunctivitis may have gone down deeper. So or on top of that is a bacterial infection, quite serious. So this is about, and also the allergy. The allergy is seasonal, it's quite common. I think it's, probably you already know it, it just comes with the seasons, and usually it's not isolated conjunctivitis or allergic conjunctivitis. It's also associated with allergic rhinitis or associated with other symptoms, runny nose, tearing together, or even dry throat. So if that's the case, I think if the first time the onset is first time, then you probably need to see your physician to check it. Or even though it's recurrent, you still need to get ready, prepared before the season comes. And usually there's some tests that can identify the cause of these allergies. But if not identified, you just have to prevent or use eye flash regularly before, after you're going out, when the pollen is really the season pollen, so then you need to really wash it well and wear goggles if you have to, if this allergy is severe. On top of that, I think the other very common conjunctival disease is the tertium. Tertium is it's overgrowth of this transparent tissue, but because increase the thickness, it's not transparent anymore. Layers of the fibroid tissue, and like a fan-shaped, may cover the cornea. Actually, toward to the cornea, to the center, usually from the peripheral of conjunctiva, and then just the thread centrally to the cornea. So if that's the case, usually what is this risk factors for this conjunctiva tertium? I think it's already very well confirmed. It's the sun exposure. It's not just the conjunctiva, but also the under tissue. The tissue under conjunctiva also affected. So this is, imagine like the sunburn, for example, the sun exposed, like cook the eggs, or causing the protein denatured or change, lost its normal, the cells lost its normal function, so then grow this kind of tertium. If that's the case, I think I recommend to check your eyes regularly through the mirror. If there's any abnormal growth, even though probably it's tiny, small, probably it's a good time to see your ophthalmologist to take it out before it covered the center of the cornea. Then if they're smaller, then you just take it out and cover it is easier. When it's bigger, you imagine the wound will be larger, and the recovery sometimes is kind of, because it can go deep, really go to reach the sclera. So sometimes the surgery is a little challenge if the tertium is big and deep. So then my recommendation is look at your eyes through the mirror regularly, see whether there's something. Probably you're the one who can identify this abnormal growth, and then you see an eye doctor will take it out at early stage. However, this tertium can recur after you take it out, but still, the earlier the better. Don't wait until covered your cornea cannot see clearly. So that's not only for yourself and also for the surgeons. It's hard. It's a challenge to really heal it, because it can go deep. The sclera have to be bare. So that's really not a pleasant situation. So so this is about the tertium and also conjunctival disease. Very simple, very straightforward, and sometimes also there's a hemorrhage, superficial hemorrhage from the conjunctiva small vessels. If that's the case, I think usually it's minor, can recover by itself, self-limited. However, do get checked. See your eye doctor, make sure nothing serious going on, particularly for those older with pre-existing conditions. So I'm going to stop here, just list some common conjunctival diseases, and I hope it helps. And thank you for watching. I'll see you next time.